Pregnancy is often seen as a simple journey of growth, but it's one of the most complex transformations the human body can go through. Behind it is a constantly shifting system of hormones, organ changes, and rapid development. In this video, we'll explore 20 pregnancy facts you wish you knew sooner. Fact 1. Pregnancy typically lasts about 40 weeks. A full-term pregnancy is commonly calculated as 40 weeks from the first day of the last menstrual period. This equals approximately 38 weeks from fertilization. The 40-week estimate provides a standardized framework for monitoring development. Birth commonly occurs within a range around this date. Today, 39 to 40 weeks and 6 days is considered full-term, while 37 to 38 weeks is classified as early term. Fact 2. Pregnancy is divided into 3 trimesters. Pregnancy is divided into 3 trimesters, each lasting about 13 to 14 weeks. The first trimester focuses on early organ formation and foundational development. The second trimester is marked by rapid growth and the onset of noticeable fetal movement. The third trimester involves continued growth and preparation for birth. This framework helps clinicians monitor maternal and fetal health. Fact 3. Human chorionic gonadotropin is detected in pregnancy tests. Human chorionic gonadotropin is produced shortly after implantation. It supports early pregnancy by maintaining hormone production necessary for the uterine lining. Pregnancy tests detect HCG in urine or blood to confirm pregnancy. Levels rise rapidly in early weeks and can help assess progression. Monitoring HCG is also used in specific medical evaluations. Fact 4. The fetus receives oxygen through the umbilical cord. The fetus does not breathe air in the uterus. Oxygen transfers from the maternal bloodstream through the placenta. The umbilical cord carries oxygen-rich blood to the fetus and returns carbon dioxide and waste to the placenta. This exchange supports development in a fluid environment. The lungs begin functioning independently only after birth. Fact 5. Morning sickness is linked to hormonal changes. Morning sickness refers to nausea and sometimes vomiting during early pregnancy. It is most common in the first trimester and is associated with rising levels of hormones such as HCG and estrogen. Despite the name, symptoms can occur at any time of day. For many individuals, symptoms lessen as pregnancy progresses. Severe cases require medical evaluation. Fact 6. Blood volume increases significantly during pregnancy. During pregnancy, the total blood volume increases by roughly 30 to 50%. This expansion supports the uterus, placenta, and developing fetus. It also prepares the body for blood loss during delivery. Plasma increases more than red blood cells, which can influence lab values. These changes are normal physiological adaptations. Fact 7. The heart works harder during pregnancy. The cardiovascular system adapts to meet increased circulatory demands during pregnancy. Heart rate typically rises, and cardiac output increases to deliver oxygen and nutrients efficiently. Blood vessels also adjust, which can influence blood pressure patterns. These are all normal physiological changes. Fact 8. Pregnancy influences metabolism. Pregnancy alters metabolism to support fetal growth and maternal energy needs. Insulin sensitivity often decreases in later stages, increasing glucose availability for the fetus. The body adjusts how it stores and mobilizes energy reserves. These changes help maintain a stable nutrient supply. Fact 9. Hormonal changes affect mood and physiology. Pregnancy involves major shifts in hormones such as progesterone and estrogen. These hormones affect reproductive tissues, the brain, and other organ systems. Changes may influence sleep, body temperature regulation, and emotional processing. Hormonal fluctuation is a normal part of pregnancy, though individual experiences vary significantly. Fact 10. The body produces colostrum before birth. Colostrum is the first form of milk produced during late pregnancy and immediately after birth. It is rich in antibodies, immune cells, and concentrated nutrients and helps supports early immune protection and digestive adaptation of the child. Colostrum transitions into mature milk in the days following birth. Fact 11. Digestive changes are common during pregnancy. Pregnancy affects the digestive system due to hormonal shifts, particularly increased progesterone. Progesterone relaxes smooth muscle tissue, which slows gastrointestinal movement. This can contribute to symptoms such as constipation and acid reflux. The growing uterus may also place pressure on the stomach and intestines. These are common physiological adaptations during pregnancy. Fact 12. The skin may undergo visible changes. Hormonal changes during pregnancy can influence skin pigmentation and blood flow. Some individuals develop darker areas of skin, such as melasma or a darkened abdominal line. Additionally, increased circulation may cause a flushed appearance, while stretch marks can form as the skin expands. These changes vary widely among individuals and may fade after birth. Fact 13. Maternal nutrition influences fetal development. Adequate maternal nutrition supports fetal growth and organ formation as nutrients such as folate, iron, calcium, protein, and iodine play specific developmental roles. Folate is especially important early in pregnancy for neural tube formation. Balanced nutrition also supports maternal energy needs, while prenatal vitamins are commonly recommended to supplement diet. Fact 14. The body stores additional fat for energy. During pregnancy, the body increases fat storage as a biological adaptation. These energy reserves support fetal growth and help prepare for lactation. Hormonal changes influence how energy is stored and mobilized, as fat distribution may shift throughout pregnancy. This reflects normal metabolic adjustment rather than abnormal weight gain. Fact 15. Blood pressure may fluctuate during pregnancy. Blood pressure often changes as the cardiovascular system adapts. It commonly decreases slightly in early pregnancy due to blood vessel relaxation and may return closer to pre-pregnancy levels later on. Persistent elevation requires medical monitoring to rule out complications, while routine prenatal care includes regular blood pressure checks. Fact 16. Gestational diabetes can develop during pregnancy. Gestational diabetes involves elevated blood glucose levels first recognized during pregnancy. Hormonal changes can reduce insulin sensitivity, particularly in the second half of pregnancy. Screening typically occurs in the second trimester. With monitoring and dietary management, most cases are effectively controlled. Blood glucose levels often return to normal after delivery, though follow-up is recommended. Fact 17. The sense of smell may become heightened. Some individuals report increased sensitivity to odors during pregnancy. This change is likely related to hormonal fluctuations. Heightened smell sensitivity may contribute to nausea, especially in early pregnancy. For many, sensitivity decreases later in pregnancy. Fact 18. Pregnancy can influence hair growth cycles. Hormonal changes can prolong the growth phase of hair during pregnancy. As a result, hair may appear thicker or shed less than usual. After delivery, hormonal shifts may trigger temporary increased shedding. This reflects a normal reset of the hair growth cycle. Hair patterns typically stabilize over time. Fact 19. The amniotic sac protects the developing fetus. The amniotic sac is a fluid-filled membrane surrounding the fetus. It cushions against physical impact and helps regulate temperature. The fluid allows movement, which supports musculoskeletal development. Amniotic fluid is also continuously produced and recycled throughout pregnancy. This environment plays a critical role in fetal protection and development. Fact 20. Postpartum recovery begins immediately after birth. Physiological recovery begins once the baby and placenta are delivered. Hormone levels shift rapidly to support uterine contraction and milk production. The uterus gradually returns to its pre-pregnancy size through a process called involution. Circulatory and metabolic systems also readjust while postpartum recovery continues for weeks to months depending on individual circumstances. Thanks for watching. Make sure you tap the like button and subscribe for more facts videos if you enjoyed this one. Feel free to also leave a comment below if you learned something new. Until next time, take care.